asking me if I want to admit. Okay, you've got it. Good. I won't touch anything.
I got it. Hello, everyone. Good morning, almost afternoon. Welcome to the May Tell Talk. Got quite a few folks already in our room. We're going to wait a couple of minutes to get started to give folks a few minutes to come on in. If you would put in the chat your name and your program, just so we can kind of see who we have with us today. Do the introductions in the chat. Good afternoon, everyone. Thank you for coming. Thanks for those of you who are putting your name and your program in the chat. Got a good group already. Thank you. Wait just another minute or so for folks to come on in. I know it's the lunch hour, so I purposely have guests having their camera and microphones muted and cameras off so you guys can sit and eat lunch or just enjoy yourself and listen to this fantastic information that we'll share. So take the opportunity to kind of relax and just listen for a while. Thanks again. And for those of you just joining us, if you put your name and program in the chat, just as an introduction, so we can see who's with us today. All right. So I'm going to go ahead and get us started. Good afternoon, everyone. My name is Heather Sharmoli. Welcome to the May Tell Talk for 2025. I'm here with my colleague, Michelle Yang from the Child Care Aware Coordinating Office. And we will be your hosts today, keeping an eye on the chat box and kind of sharing the initial information. TEL Talks are specifically for early learning leaders and monthly webinars based on information that we think needs to go out and from feedback from our audience. So if you have something that you think we should share in a TEL Talk, please let me know. I'd be happy to get somebody else on the schedule. So folks can learn more about the field and hear things that they need to hear going forward. We do have our next few TEL Talks planned out. Next month, after our legislative session has ended, we are going to get an update from Kara Lebke from the Child Care Aware Coordinating Office to learn about what changes were made affecting early childhood education this session and what that means for us as educators in the field. July 8th, we will have some folks from our financial supports department in to talk about what financial offerings are available for educators and programs throughout the field and how you might use those within your program. And then August, I decided we're going to take a summer break and then we will come back in September. So Child Care Aware of Minnesota helps families find quality programming across the state. We work in 5 regions and several different districts across, 5 districts and several regions across the state. And we work through professional development. We help coordinate the Eager to Learn online professional development program. We work on some grants for Parent Aware regional grants, Retain. We work on the Teach Scholarship and CDA scholarships. For those of you who don't already know, we have the CDA program starting this summer. We're hoping to get classes kicked off mid-July. For the MNCDA, which is kind of a reboot of our program. It's going to be all online. And we also coordinate the Empower to Educate program and do some trainer and relationship-based professional development support for the early childhood field. And we're also here to keep the community informed and connect people across the state to resources that are needed. So in addition to our work, here's our Child Talks team. Myself and Michelle will be kind of keeping an eye on things for our guests today. So I would like to welcome Kara, Brenda, and JC from the Center for Inclusive Childcare. And I will stop sharing so you guys can share your content. And I will turn it over to you.
Welcome, everybody. Thank you, Heather, for your introduction. My name is JC Nylander. I am a coach lead at Center for Inclusive Childcare. So in my role, I support a team of our coaches who are located all throughout the state in their coaching work. So anything related to coaching and coaching processes, I am involved with. I also work with a co-lead who is Brenda Lowe, and I will let her say hello. If you have anything to add to what we do, Brenda.
JC pretty much said it all. Thank you, everyone. Hi, I'm Brenda Lowe, and I'm happy to be with you today. You know, we have a small and mighty team of coaches that supports our state. And I can't wait to tell you more about them today. So welcome all of you. And with that, I've got one more lead on our team that helps support us. And Kara, I'll let you introduce yourself.
Yeah, so I'm Kara Keene. I'm the Early Childhood Leadership Development Lead at CICC. I'm thrilled to be here and to share a little bit about what we do across the state.
I'm going to kick us off today and tell you about CICC and how we support providers throughout the state. There's three main ways we do that. Through our coaching, through our leadership coaching, which is ECLD, referred to as ECLD, and our resources. You'll see Reflective Practice Community Cohort is on here as well, and that's a pilot program, and we're going to share about that today. Not something that is concrete with what we offer, but something we wanted to share that we've been trying out for the last 6 months. You can go to the next slide, Kara. So at CICC, our mission is to be a centralized, comprehensive, and responsive network supporting quality care for children in community settings. So that means that we work with providers or educators in the field, family child care settings, center-based settings, leaders, teachers, to help with inclusion work and support them in providing that. So we believe that all children should have opportunities to participate in quality care and education. And as many of you know, that's not an easy task. So we want to support the educators in doing that. Another thing we believe is that parents and professionals should have access to resources that support each child's optimal development. So we have a really great website. Some of our coaching does involve some connections with families too. So we support families through our coaching occasionally, which we'll talk a little bit about too. As you saw on the previous slide, like I said, there's three main ways that we live our mission out, and that's through our coaching, our ECLD program, and our resources. Brenda is going to kick us off here, telling us a little bit more about the coaching that we provide.
All right. Thank you, JC. Good jump start. So what we like to say at CICC is that we're partners. We're partners with our providers in this journey that you have with children and families. So we like to, if you want to visualize with me for a second, Just picture yourself like walking through a beautiful forest or a beautiful wooded area. And as coaches, we like to say that we're walking alongside of you and holding a flashlight open, like you're in charge. You know where to go, you know where you want to go. But sometimes you just need someone to hold the light so that you can continue on in your journey. And so that's what we envision ourselves as a coaching team. Um, and then we are a free program. So that's, you know, an amazing thing. I wish I would when I was an educator in the classroom. We provide the free coaching to all licensed childcare across our state, and we'll talk more and more about what that looks like. But we currently are offering English and Somali languages. We have English and Somali coaching available, and yeah, and we service the entire state of Minnesota, so the 7-county metro area. So our team disperses and goes and supports programs, and I'll tell you a little bit more. It'll make more sense in a second. Next slide, please. So I mentioned that we support childcare centers and family childcare. We're licensed. We support those that are licensed through our Minnesota Department of Children, Youth, and Families, otherwise known as DCYF. And it's just an amazing opportunity for both our childcare centers and family childcare. Our coaches are well versed, and I like to consider them experts, although they're so humble. They're like, I'm not the expert, but they are well versed in both supporting childcare centers and family childcare across our state. Next slide. So what our coaching model looks like is we provide coaching over a 3 to 5 month period, and that might be virtual and a combination of virtual only or virtual plus some in-person visits. And during that time, you have a coach will do an observation with you. They'll actually have some one-on-one conversation with you. You are communicating on a regular basis, whether that be well, you'll have scheduled coaching sessions, but then also there's that in between time. You're like, hey, I just want to bounce this off of you. Hey, do you have a resource for that? Hey, I need support on that. Can I ask you a question, coach? So there is constant communication, and they meet regularly. So usually every week is our preferred pattern of communication. While you're with a coach, you are working with them on setting goals and action steps so that your classroom or your programs are like reaching for excellence. Like, we know that there's no such thing as perfection, but we do want to help you reach for that next level wherever you're at, and reach for that next level of excellence so that you can be stellar and confident as an educator, and feel competent as well. Next slide, please. We have 3 coaching can look like. Here's some examples of what coaching may look like. Like, for example, caring for a child whose behaviors challenge adults, or creating safe and healthy learning environments, or meeting the unique needs of infants and toddlers. We have 3 main umbrellas, if you will. So we have health and safety, which is general, it's licensing questions, it's environment, it's supports. I need help with classroom management. We have our inclusion umbrella, which includes I need help with a child that needs supports for being included in the classroom. Or I need help with challenging behaviors, like what can I do? And then we have our infant and toddler specialty. So I'm needing help with biting or sleep, like sleep transitioning, parenting supports. Like I'm feeling like I'm off with this family. I'm not communicating or on the same page with them. Help. What can I do? So it's like 3 umbrellas, but we as coaches know what that is, and that every week might look a little bit different as far as what supports might be needed. But these are just some examples of areas of focus that you might see coaches working with other educators on. Next slide, please. So our coaching model, we are all about the relationships. Like you can't do anything else without relationships. So that's relationships with one another as colleagues. That is with the families, so the educator and the families. That's with the children, right? Like you need to have even the harder to love children sometimes, right? We have to build a relationship with them so that they can be responsive and we're intuitive on what their needs are. And then we begin this dance and then away we go. So we work with you together on building those relationships and helping you where the struggle is. And like the old say, like the struggle is real. Yeah, it is. And so we want to help you with that. And then we identify some goals, create actions plans, and then we review that progress. And we just keep going around and around and around as you start building yourself towards sustainability. You know, we want you to be able to have some tools in your toolbox, your teacher toolbox, as we like to say, where you can say, I have a couple other additions. I had a hammer and a screwdriver, but now I have a hose and a garden rake in there too that I can pull out and use for my practice. So that's what we like to do. Next slide, please. Through coaching, this might be some of the outcomes that you might see. So I had showed you before how like what our coaching process might look like. And through that, then some of those sustainable practices, this is what it might look like. So refined current practices, reframing your approach with children and families, strengthening your identity as a professional and feeling confident. Like who doesn't want to feel confident? Who doesn't want to have that strong relationship with that child that is just not responding to me and I don't know how to respond to them? Developing strong, consistent new routines, practices, and policies. Like I was just out on a coach visit today and they are the most beautiful program with just skilled, hardworking educators. Are they doing things great? Yes, they are. Are there some things that I might have for some helpful tips and tricks that might help them improve their practices and feel more confident and have some sustainability in their programs? Yeah, I think I might be able to add to that. And like I said to an educator on the way out the door today, I'm like, well, my coach will come with you and walk alongside you and she'll have some ideas. And if we don't like them, we try something else, right? It's just like with a tool and toolbox. You're like, oh, the hammer didn't work. Let's try the screwdriver. At least that's how I do it. All right, next slide. So I told you about the three umbrellas, right? The health and safety, the inclusion, the infant toddler specialties. And that's more environmental, big picture, big classroom, whole classroom approaches. We also have a focus. Sometimes it's necessary to just focus on a child, not as a para, not as a one-on-one service, but the goal and the action that needs to be taken is surrounding a child. So when that happens, we have parental family consents, which allows us to have that specific observation and plan supports or planning to help the teacher support the child, coordination with third parties. So we help the educators work with the school programs, with the OT, the PT, the speech therapist. There might be private parties involved that I know sometimes we need help navigating. So that's what we do. And we also work with you to help support those families and those families in our interactions. I guess in some ways we're advocate for them too. We help empower that family to feel like they have a voice and they bring that voice to the table. And then we're also empowering that educator to have that voice at the table. And then together, that's where the magic happens because communication is happening and finding that common ground. Next slide, please. So a couple of misunderstandings about CICC. This is what we are not, is there's no fee for us. You're not going to get a magical bill that comes 3 months later. We are free. Thank you, DHS, for providing us that. So, but it is for licensed programs, and that would be tribal or licensed through DHS. We do not conduct child assessment. So I just had mentioned that. We do observations of the child in the classroom and the educators, but not individual child assessments like for example, the pre-K assessments that happen at the school districts. That's not what we do. But we do help with referral services. And like I said, also we don't provide one-on-one supports for a child, but we will help you with strategies, modeling strategies, helping you with the interactions, helping you with the family, helping you with the network. All right, well, Kara, I think I turn it over to you to talk a little bit more now about ECLD.
Yeah, thanks, Brenda. Heather, do we have any questions before we dive into the next arm at CICC?
Nope, you're all set.
Okay, perfect. So for a little bit, I'm going to dive into our leadership development at Center for Inclusive Childcare. About 2 years ago, we launched this arm. We heard from directors statewide that a lot of directors and leaders are feeling isolated. They're alone. They need support. So through all of that in piloting, we created the Early Childhood Leadership Development arm at CICC. And so we've been running for about 2 years. It operates on a cohort model, and really we are there to support the directors and leaders in the field. So we really, again, like Brenda said, it's all based off of your relationships. So we form a really strong relationship with the director, and get them connected with others and trusted professionals in the field. So really kind of creating those networks of support. We really focus on build that cultural competence, and really equipping the directors to lead with intentionality. So really trying to have them slow down, reflect, and think about their practice so then they can equip their center, their staff to improve. Really enhance those management skills and then support that trauma-informed care. I'm going to touch on kind of our assessment that we do, but we do focus on that whole leadership approach, to look at the whole picture as a leader. A little bit about the cohort and our model. We usually have 6 to 8 leaders in a cohort. It is a 6-month commitment for the director. So a little bit about what that 6 months looks like. There is reflective, a community of practice once a month. And then each director gets one-on-one coaching with a coach, to really dive deep into what they need support on. And it's really for personal growth. So there is no set curriculum. There is really, homework is driven based off of the director. So the coach comes in, we build that relationship with the directors. We get to know them. The director communicate where they need support, and that's where that coach comes alongside and really supports them. And the cohort model itself, the coach takes kind of the themes that they're hearing from each leader, and that's what they've come together in the community of practice and they focus on. So some of the topics that have come up before, onboarding, staff turnover, burnout, delegating tasks. How do you do that as a leader, as a director? How do you delegate? And so the topics are endless, and we really get those topics from the leaders in the cohort. And then we do a lot of phone visits. We do check-ins throughout the month as well. And I did want to highlight, we have a couple of testimonial videos that we wanted to share. And this is from participants that have participated in our cohort of early childhood leadership development, and kind of what their story, what did they come out of their 6 months with. So I'm going to share these testimonials for you to listen to.
What motivated me to keep coming back? There were definitely times where I did not want to show up. I think that part of it was that our cohort leader, I felt a sense of connection and responsibility with her. and I wanted to show up for her. And that was important because sometimes I wasn't ready to show up for myself. The other piece was that at the end of the day, I trusted the process, and I knew that every single month I was seeing growth in myself, and I was changing as an owner, as a director, as a leader, and also just as a person in general. I think that I became a better wife and a better mother through this process.
We have one more.
The family engagement was deep for me because I kind of wanted to keep the family out. You're there and we are here. And so we work with your children on what we do. But when I listened, we talked, I learned, I thought, I practiced it, and I seen, oh, this really opens up and it's good for the children. You learn what's going on at home, what they may do here or there, and you're able to engage with them. When you speak with the family, the children are more in tune because, oh, you know my mom, you know my dad, you know my grandma too. Yes, so it becomes much, much more. And I didn't feel that in the beginning. It was a for me. But when in doing it, and I'm so good with all the parents, they're coming. I love it.
And so with that, I kind of wanted to highlight if you are looking for more information about our leadership development arm, we have a phenomenal website, and I'll show you at the end. I'll put our live website up and kind of navigate through some of our resources, but you can go to our website to learn more. Cohorts are offered on a regional basis, and every 6 months we'll be launching new cohorts. So in the meantime, if a leader is interested, we encourage them to express interest. We have an interest form to join our inquiry list to get within the cohort at some point. And JC, I'm going to pass it on to you.
I liked how you did that questions, Kara, between, is there any ECLD questions, Heather, that came up?
No questions specifically, just a lot of compliments on all of you and the amazing work that you do.
This pilot group that Brenda and I have been leading. I'm really excited. So this is brand new to us. Like I said, it's a pilot. It's been in the works for quite a while. All of us leads at CICC have been learning a lot about reflective practice through trainings, books, together, being more intentional about our reflection, as well as our coaches too. We've really tried to weave that. There's a lot of overlap between coaching and reflective practice. So I'm going to talk a little bit about what is a reflective practice, and then I'll talk more about what that looked like for us. There's a lot of different definitions of it. And it's tricky to explain, but I really liked this one. I thought it captured what our focus was at CICC. So an invitation to think deeply about our actions so that we may act with more insight and effectiveness in the future. One of the things that CICC does is we really try to respond to the needs of providers in the state while upholding our mission. So what are the needs that we're seeing, and does it align with our work? And something that we recognized is that in our own work, we all receive reflective practice, and at CICC, our coaches too. And we're like, wow, I don't know if I could do my job as well as I do without my reflective practice. And so thinking about providers, that would be really beneficial for them. The state has also recognized this, and there's now, you can become endorsed in reflective practice, or I guess it's called reflective supervision, ERS. So Brenda and I both have that. So we're endorsed as reflective supervisors. So that prompted this as well. The other part of it is that everybody could use this. It's not something that you you master and you're done with it. It's an ongoing practice, regardless of how much experience you have. So we recognize that it's a need in the field. So we gave it a try. You can go to the next slide, Kara. So how do we do it? What does it look like? And you'll see a lot of these themes that they're similar to some of the things that Brenda and Kara mentioned about ECLD and our coaching. There's a lot of overlap here. So in our reflective practice, we suspend judgment that is of ourselves, suspending judgment of ourselves, and suspending judgment of other people or children or families, whatever it might be. We pause to take time to think about our thinking. Why do I think I'm thinking like this? What past experiences have brought me here? I think also within this thinking about our thinking is thinking about how others might be thinking. So in a situation, perspective taking, what might be going on for that child when I respond to them that way? And this takes a lot of intentionality for all of us. A common theme you've already heard us mention multiple times, we focus on relationships. I'll talk about our group in a second. It's only been 6 months. We meet once a month, but already relationships have been forming. And that's just foundational to everything that we do, and so important in a reflective space to build that trust with your group. The last one here, we did our reflective practice as a group. It can be done one-on-one with a reflective consultant. Ours was a group. This allows for community, creating a sense of community, which I'm going to talk about in a second as well. Sometimes in our group too, solutions came up. That's not the focus of reflective practice, but sometimes solutions were offered from other people. Again, kind of that overlap between coaching and reflective practice. Something else I wanted to note about reflection is sometimes it comes very naturally. I think the more you practice it and the more you're intentional about it in your work, you'll find yourself just doing it. But like I mentioned, regardless of how much experience you have, being intentional about taking that time to pause and think is something that we all have to do forever. Okay, next slide, Kara. Oh, Kara is also endorsed as our ERS. Sorry, Kara. I didn't list you. All three of us are. So why do we do it? Why did we come up with this idea and want to implement this? So creating a sense of community. I talked about our group and coming together. I think Brenda and Kara both alluded to the feeling of isolation that people might experience in our field. And so who are your people to go to and talk through things that might understand what you're going through? We know that becoming better ourselves leads to better outcomes for children and families, which is always a goal for us. And the final reason is support for the field. Again, we recognize that need for educators. We see the burnout, we see the turnover, and we're thinking, how can we prevent this? What supports do those educators need? And we're wondering if reflective practice could be one of the pieces of that puzzle to help in preventing that. Was there a question, Heather?
Yes, in the chat, someone asked if the reflective consultation can help on site. Not sure if that was clear for them.
Like moving forward.
Sorry, JC, the first part of that was cut off. Could you repeat that?
Yeah, sorry. Is my sound okay now? Okay. So right now our reflective practice pilot group that we did is brand new. It's the first group that we've done, and we don't know what it will look like moving forward, what we'll have to offer. The next few months for us will be some planning and decision making with what that could look like and how we could make it work with our model. So I don't have an answer to that right now. How we did our group, it was a virtual group. Everybody came together virtually. Good question. So a little bit about the pilot group that we just did. It ran from January to May. Our last session is on Thursday, so 6 sessions. We worked with 7 educators who had completed coaching with us. So they went through a coaching cycle. And our coaches said, hey, would you be interested in trying this out? And we got 7 who were interested. We would keep the groups around that. Those, like Kara mentioned, for her groups is like 6 to 8. That was a good size group for reflective practice. Our group had a mix of roles in the field. So we had educators in the classroom, educators at our family childcare, and some directors and area directors as well. And then also from various parts of the state. So like I said, what's next? We'll see. We're not exactly sure. We're going to take some time to debrief and reflect and see what the future is like for our reflective practice groups. This is just giving you an overview of what our sessions looked like. They're very open-ended. Brenda and I had an icebreaker of some sort to help build collaboration and build relationships in the beginning. But after that, we left it very open-ended. What's going on for you? What challenges do you want to bring to the group? Is there anything that's been on your mind that relates to your work or personally? And even from the very beginning, there was never lack of things to talk about. I found the group throughout the 6 months, definitely the relationships were built and they got more comfortable with each other. But I would say even from day one, there was conversation and participation right away. I'll get to the reflective part in a second here. We always closed out a few minutes early, took a deep breath, or we would have some homework, which, similar to what Kara mentioned, was very adapted to what we talked about in the group. It was thought of on the spot. How would it feel for all of you if you practiced 10 minutes of self-care over this week, because we talked a lot about some really heavy things today, or we talked a lot about families. I would like each of you to try and connect with the family that you mentioned today in one positive way, and then we'd follow up with it in the next session. But like I said, the bulk was whatever the group needed. As far as the focus, I just kind of wanted to talk about what Brenda and I, our role as a facilitator was. And I mentioned what it is. And so a couple slides ago, Brenda and I were really just there to practice those. So suspending that judgment, helping them to think about their thinking. How do relationships play into this? Perspective taking with them, or pointing out their emotions. Sometimes, just like we do for children, we would say, I can tell that you have a big feeling about this. What's going on for you as you talk about this family? And recognizing how past experiences, sometimes past experiences help, and sometimes they're a reason for why we're feeling what we're feeling, and sometimes we can pull that out in reflective practice. So Brenda and I would jump in and try to support the group in that way. But it was a really great experience, a lot of learning from each other, a lot of learning for everybody in the group, and Brenda and I as facilitators too. So registering for the cohort right now for the pilot group, we don't have any registration options right now. Once we do start any groups, if we had a registration, it would be available on our website when we get to that point. For the ECLD cohort, Kara, you'll talk about that when you talk about the resources part, how to register.
Yep.
Yeah, any questions about our reflective practice pilot group before Kara closes us out with resources? Didn't see any come in.
I just want to comment, I think it's such a unique and amazing opportunity. It sounds like the group that you have is really embracing it and doing really well with it. And I think, I'm really excited that you have this opportunity to share with our audiences. And I think you're going to get way more people excited about continuing that work.
I think it's definitely, as I mentioned, something our field needs and would feel really supported by. So we'll see what the future holds.
Thanks, JC. So I'm going to dive in and end our time highlighting the resources that CICC offers. And a lot of our resources are on our website, which I'll show you in the next couple of slides. But the main four that we are self-studies, which are found on our website, tip sheets, again, found on our website, podcasts and videos. And so a lot of one example, directors come to me and say, oh, a teacher needs training for parent-aware renewal. We don't have time. They don't want to take, evenings or a Saturday course. I always direct them to self-studies. That's just one example. Our website is full of resources. So I encourage you guys to kind of go to the website and poke around and learn and see what we have. Resources are offered in English, Somali, and Spanish. And then there's also a tab for families, caregivers, as well as child care providers on our website. Another thing that is included on our website are these 2-minute tips. And so if you're looking for a quick video on a topic, there's a whole list of resources and they're all the 2-minute tips. So just wanted to highlight that resource as well. So I mentioned a lot on our website. So we're going to we have a few minutes. We're going to go to our website and just show you, this is our platform, our main page. If you're looking for coaching support, there's more information on how to get connected with coaching. It's really simple. You basically email or you call. That's the extent of that reach out. Some of you have questions about our leadership development and how you can join a cohort. Down here is some more information, kind of what we went over today. How does it work? What's the model? We always update this page of where our next cohorts are moving towards within the state and when we're launching. So we are launching 2 more come July, and they're going to be throughout the whole entire state. If you want more information, my contact is down here in the corner. And then this is the form that you would fill out to show interest. It's very quick. It's 1 page. It's not in depth. So if you're interested in that, you can encourage others to fill that out as well. We do have a mentor group that supports leadership development that we meet twice a year. And then we also provide a leadership development newsletter monthly. So people can go in and subscribe to receive that as well. I mentioned self-studies. So this is our page, and you can select a topic that you are interested in or wanting to learn more about. You can filter through the language that you're looking for, or you can even type in a keyword. So, environment, challenging behaviors, and then it will pop up, and then you can click on here, and then that will prompt you to how to register. Resource library is available, free for anybody that goes onto our website. And again, you can search for topics. And then this is where you will find tip sheets, resources from the website, or it's a document as well. And then here is parent, grandparent, and caregiver information. And we have our buckets of information on here. organized by tip sheet, info, and helpful links. Preventing expulsion. So we have a tab strictly focusing on all of these different areas that are available to all of you. Our 80x3 content. Again, resources available to you as well. So there's a lot of free resources. Podcasts are up on top and videos as well. So that is our website. It's always changing. So as we close out, we are mainly funded by DCYF, but we do work very closely with many partners around the state. So this is just a list of a few, but we wanted to highlight that partnership because those relationships are critical. If you're looking for contact information, our phone number is on our website, but also here. You can email at info@, and again, our website. Just want to thank all of you. So thanks for your time. Heather, I don't know if you have any other questions that came in, but.
No, the only other comment that came in was hopefully you'll have some resources soon in Arabic. And I know, being able to translate into other languages is not always really inexpensive, but it's certainly something that's wonderful to be able to connect with more of the communities across the state. And I'd like to just take a moment again to thank you, Kara, JC, and Brenda, to come and share all of this with our network. And I am so thankful for the work that CSCC does. I've been a big fan for a long, long time. And I just am so appreciative that we have an organization like yours in the state of Minnesota, because I know a lot of other states have this type of built-in support. And you are small but mighty, and the impact that you guys make does really ripple across the state. So thanks again for spending some time with us to share more information about how people can connect with your organization to better themselves. And when we know better, we can do better.
Thanks, Heather.
Thanks
Right.
everyone for coming.
All right, lots of thank yous in the chat. And with that, we will wrap up a couple minutes early today. And hopefully everyone can get outside and enjoy some extra sunshine. Take care, everyone. Thank you.
Bye-bye.